Hi there, Internet people. This is Dr. William here, and welcome to Med English 101. Today, we're starting with our first lesson of medical English. Our topic today is very important. We are going to talk about medical abbreviation in English. Why is medical abbreviation very important? It helps saves a lot of time when you take in patient medical history. It is also not uncommon to see a lot of medical abbreviation thrown into medical articles, and also those of you preparing for USMLE and PLAB. It is very important to know medical abbreviation because in most of the questions, medical abbreviations are used. Nobody writes myocardial infarction, it's too long. So expect to see medical abbreviations such as MI, UTI, urinary tract infection, and the examiners expect you to know these medical abbreviations. So, without me waffling, let's jump straight into today's lesson. Into our lesson today, important medical abbreviation. Forgive me for writing this in Russian. I made this presentation for my Russian students as well. So, let's jump into the first slide here. Now, let's pay attention to medical symbols, okay? Those of you who are interested in what this word means is znaki, and znaki means symbol, okay, in English. This is Russian. Forgive me, I just didn't really want to change the whole presentation again. So at least you can pick up some few Russian words in our lesson. Let's take a look at the first symbol. This symbol means male. It's a universal symbol. Regardless of which country you are, it's always going to remain the same. So we're not going to waste time here. Now the next symbol here is female, okay. Next symbol here, increased, raised, or elevated. So let's say you have a patient whose labs shows increased potassium. You could always put this sign and the potassium sign, and that will mean this patient has an increased, raised, or elevated potassium. Now this sign obviously means decrease. Again, you have a patient coming with labs showing low potassium or sodium. You just put this sign here with an Na plus or K plus, which is going to mean decreased potassium or reduced potassium. So let's take a look at some examples of how to use these medical symbols, okay? So let's these sentences together and try to figure out what these signs mean. So the first sentence here, a 25-year-old, okay? So what we have here, male, so it's a male sign. A 25-year-old male patient presents to the ER with, okay? So we'll figure out what ER is in a bit, okay? Second sentence, the patient's labs reveals elevated potassium, raised potassium, or increased potassium. Now let's take a look at some more medical abbreviation here. C/O means complaining of. Again, a 25-year-old patient presents to the ER, C/O complaining of. Okay, so don't panic anytime you see this. SOB, shortness of breath, okay? So in some medical cases or in some medical articles, they just write SOB for short. That means shortness of breath or dyspnea. That's in Latin, okay? R means right or respiration. Accident emergency, that is A&E, okay? You are more likely to see accident and emergency if you read in, let's say, medical articles from Britain. But if you read in medical articles or medical cases or books from America, it's more likely to be ER, okay, emergency room. C, with, pretty easy, nothing difficult here. Y/O means year old. So again, a 25-year-old. Why do I keep using 25 year? Anyway, I'm not 25. If you wanted to guess my age, I'm not 25. Anyway, CT, computer tomography. MRI, magnetic resonance imaging. So if you read a medical case and you have to choose a method of investigation, you probably see CT, MRI, and you know exactly what these are. So let's take a look at taking medical history and some abbreviations that you may see when taking patient history, okay? So PH stands for past history. FH stands for family history, okay? You want to find out if there's any genetic disease in the family or whatever diseases that might be in a family of a patient that you're taking a history of. Okay, HPI, history of present illness, that is more about why this patient came to the hospital today. So why the patient drove all the way from home or got into the bus or the metro to come to see you as a doctor today. So that is going to be HPI. Let's take a look at vital signs here. If you see RR, it stands for respiratory rates, okay? and it's measured in breath cycles. Okay, so normal range is going to be 12 to 21 breath cycle per minute. BP stands for blood pressure, P stands for pulse, T stands for temperature. Let's go to the next slide. BMI, another important vital sign here. And you're more likely to see BMI rather than body mass index. I don't see anyone actually taking the time to write body mass index. GCS, Glasgow Coma Score. So we have actually gone through quite a lot of medical abbreviations, and this will help you understand pretty much most articles and medical cases that you read. So do not panic if you see any of these words. Okay, so I have this case from you. This was a random case that I chose from my question banks. Okay, so what I want you to do is to rewrite these medical cases and try to convert all the medical abbreviations yourself, and let's see what you have. Okay, so let's go through the questions together. So we have a 4-year-old female patient is brought by the mother into the pediatric accident emergency with a history of fever, headache, and vomiting for the past 2 days. She's drowsy and difficult to wake up. She had a seizure an hour ago, which lasted for 4 minutes. Her respiratory rate is 40 breaths per minute. Okay. Saturated oxygen or oxygen saturation or SpO2 is 90%. It is decreased. Temperature is 39 degrees Celsius. If you read in American cases or American articles, it's obviously going to be in Fahrenheit. Capillary refill time is 3 seconds. Glasgow Coma Score is 11. During investigation, she tends to turn away from any source of bright light. What is the single most appropriate investigation that will lead to this patient diagnosis? So I guess by now you've probably already guessed the patient's clinical diagnosis, okay? There are some very important giveaway points here. In my opinion, the biggest giveaway point is the fact that this patient turns away from any source of bright light. So that means this patient is photophobic. Okay, now let's take a look at some of the details we have here. Patient oxygen saturation is very low. 90 is not good for a 4-year-old child. Respiratory rate is 40, which is really bad. Things are not looking so good here. Looks almost like a respiratory distress. Okay, so by now you already guessed that this patient is having meningitis. If you guess meningitis, then you're right. You're on the right path. So what is the most appropriate investigation that will lead to this patient's diagnosis? Blood culture? No. Blood glucose? No. Chest x-ray? No. CT of the head? No. CSF analysis. Okay, so that's going to be the right answer. So you can see that in this question they actually use a medical abbreviation, and the examiners expect you to be able to understand these medical abbreviations because you're a doctor. You don't have time to be writing cerebrospinal fluid analysis. Okay, also if you're reading American article or any medical material written by Americans, it's more likely to be lumbar puncture or spinal tap. So CSF, lumbar puncture, spinal tap means the same. Okay, so that's it for this lesson. If you liked it, give it a thumbs up, share with your friends, and don't forget to subscribe and wait for the next lesson. See you later. Bye.